San Diego health officials say the flu has killed 6 people in the county this flu season, and they say the number of people with influenza in the county has doubled since last week to total 670 reported cases. Director of Emergency Medicine at UCSD, Dr. Tomaszewski, joins me to talk about what's likely to happen next as far as when the flu will peak and what people here can do about it as far as protecting themselves. Thank you so much for joining me.
Sure.
San Diego has what is considered a late flu season. When is our flu season typically, and has it peaked yet?
Usually the peak of the season is in February, but it may come in January this year, a little earlier. And the thing that helped it is the cold, dry weather. I mean, that's what the flu needs to spread.
And how does it spread that way? Because I think there's a misconception that cold weather causes the flu.
No, and drafts don't do it. Sleeping under the air conditioning doesn't do it. It's the cold, dry air allows it to get aerosolized and survive longer.
All right, and people are indoors more, I understand, so they're in closer contact with people who...
Perfect combination for a virus that wants to spread, absolutely.
Of course, we've heard across the country that there's been many deaths, and this seems to be a particularly bad flu season back east. And is the flu strain this year particularly worse than other years?
It's not the worst, but it is a bad one, and especially if you have high risk factors to get complications from the flu.
Such as who would be most at risk?
The elderly, people over 65, infants, and pregnant women, and anyone with a coexisting illness, you know, lung disease, heart disease, kidney disease, that kind of thing.
And these people, can they get vaccinated, and who should be vaccinated?
They can absolutely get vaccinated. I think everyone should get vaccinated because not only do we need to take care of ourselves, we need to keep this virus from spreading.
And let's talk about that spread. So the couple things that everyone knows about: proper hand washing, right? And then maybe staying home. What can you recommend as far as if you think you're coming down with the flu, what should you do?
Stay home. Do us a favor. Don't spread it. And if you need to go out or see other people, try to keep your cough to yourself. Cough into your arm or sleeve, and make sure you try not to touch your face, and good hand cleansing.
Yeah, it's amazing how much hand washing can actually statistically improve lessen the spread of the disease. I would like you to dispel some misconceptions about getting the flu shot, getting a flu vaccine. Tell us what the truth of it is. Can you get the flu from a flu shot?
If you're going to give 100 million flu shots, like the number of people have gotten the flu shot this year, somebody is going to get sick at the same time they get the flu shot. And because of magical thinking, they're going to think that the flu shot caused it, when in fact it's the opposite. The flu shot rarely, if ever, causes any illness. You might have a mild allergic type response, but you're not going to get the flu from the flu shot, and you're not going to get sick from it.
Right, and the reason is because it's not a live virus, correct?
Absolutely, right. It's been it's been killed, so right.
There's no way you can get it from that. Is it too late for people in San Diego to get vaccinated? Have we passed the mark where it would do us any good?
The good news is we're just on the shoulder. The fun is about to start in terms of the flu, having a party here. So go get the flu shot. It's not too late.
Okay. How do you know when you should go see your doctor and or, dare I say, go to the ER when you have a flu?
Most of the flu can be handled at home with fluids and maybe something to help with the fever and the muscle aches. But if you have a coexisting illness, you're pregnant, you're older, or you have illnesses of the heart or lungs, then you probably should call your doctor if you think you're coming down with a flu.
So doctor first?
Right, and go to a local clinic if you can't get a hold of your doctor. You really don't want to go to the emergency room unless you're having the warning signs of the flu.
Okay, which would be?
Chest pain, trouble breathing, abdominal pain. You can't keep up with your fluids, you're vomiting so much. So in those cases, then I could see you coming to an emergency department or calling your doctor.
Because it's moved to a severe. I want to touch on this. A few retailers, I understand, are here in San Diego saying they've run out. They don't have the vaccine. Is there a shortage?
I don't control the supply chain for the flu virus, for the vaccine, but I've heard of spotty shortages in areas. The good news is more supplies are coming in. So if you get a chance, I can't guarantee it's going to stick around. If you see see a vaccine, go get it.
Go get it right then. All right. Thank you so much for talking with us about this, and you'll be back over at the hospital, and we appreciate your insight.
And we'll see how many cases we get this year.
Okay, we will.